Hi Pam, how are you?
I'm fine, how are you?
I'm doing well. What brings you to the office today?
Well, 2 years ago I had endometrial cancer. I had a hysterectomy and the doctor said that I was cured. But lately I've been feeling very tired, bloated, and constipated.
So tell me more about that.
Well, I tried taking laxatives. Sometimes it helps, but not overall. My stools have been thinner than normal. They did look a little red a couple times.
How often are you taking laxatives?
Probably once a week.
And are they helping?
Not overall.
Okay. Tell me about the redness that you're seeing.
There was just a little bit in the stool. It wasn't a lot of red, but it was a little bit of red.
Do you have hemorrhoids?
No.
Okay. All right. Any pain when you have a bowel movement?
No pain.
Okay. Any abdominal cramping?
No, but sometimes after I go to the bathroom, I still feel full.
Okay. When was your last colonoscopy?
I've never had one.
Okay. It's really recommended that everybody start screening at age 50. And since you've never had one, would you be acceptable or amenable to us setting up an appointment to have your colonoscopy done after we check out?
Yes.
Okay. All right. Well, as you may or may not know, your abdominal cavity runs from your sternum, xiphoid process, down to your just above your pubis, and then on both sides, and then it's bordered on the back by the vertebral column. All of your major organs lie within your stomach, within your abdominal cavity, and even some of the abdominal muscles, there's actually 4 layers of them, are responsible for helping digest food. Of course, you bear down to help you go to the bathroom. Your stomach is primary function of that is to digest your food by chemical as well as mechanical breakdown. And then it goes to your duodenum, where the bile, which comes from your gallbladder, and it's produced by your liver. It's excreted into the duodenum, as well as enzymes from your pancreas, and that helps break down your food. Also B12 is absorbed there, and some other things are absorbed in your duodenum. And then most of your nutrients are absorbed in your small intestines. Then what's left goes into your large intestines. And what the large intestines do is they just do our water reabsorption as well as our sodium. And then, of course, whatever we didn't need is excreted. So it sounds like you might be losing some water there as well. That might be contributing to making you tired. I'm going to send you home with a kit for occult blood, and we're going to test those stools. So the next time I'll tell you how to do that before we go, okay? Also, the kidneys, thank you. The kidneys in your body, the kidneys are on the posterior flank on each side, and they're responsible for blood pressure control, as well as filtering your blood and getting out some of the impurities. Then they flow to your bladder, and of course your bladder then excretes the extra water that we don't need, along with the waste products from our body. So what I'd like to do now is just do a quick exam of your abdomen. Okay, I'm going to clothe you and try and keep you modest. Okay. Now what I'm going to tell you, everything I'm going to do, I'm first going to look at your abdomen, and I'm going to see that it's symmetrical, that there aren't any bulges, there's no waves, there's no rashes, there's no bruising. I'm going to look for anything that's abnormal. Okay? And the next thing I'm going to do is I'm going to auscultate. I'm going to listen to your bowel sounds. And I don't want to do that before I start poking around, because that's going to change things. Okay? And I'm going to listen with the bell of my stethoscope, because I'm going to be listening for lower tones. Sometimes you'll have higher tones, and that may indicate either some air or obstruction, so I'm going to be listening for that. Also, your major vessels run through your body. You have your aorta, and that feeds your lower extremities, provides oxygen and nutrients to your lower body. It also provides blood flow to your internal organs, your kidney, as well as your bowel through the mesenteric arteries. Okay? So I'm going to be listening for any abnormalities over those vessels, as well as listening to your your intestines. Okay? Oh, I hear bowel sounds. You must be hungry. Are you hungry?
A little bit.
Okay. All right, now I'm going to switch it over to the diaphragm and then listen again. And I'm going to be paying attention, listening for any bruits, which might indicate obstructive blood flow or aneurysms. Okay. Okay, everything sounded fair. I heard you had good bowel sounds. I didn't hear any bruits. So the next thing I'm going to do is palpate, and I'm just going to put my hand on your stomach. And I'm just feeling for anything unusual. Now I'm going to poke around in your stomach a little bit. And what I'm feeling for here is your liver. And that's, remember, responsible for bile production. And over here is your pancreas, and that helps us break down our sugars. Okay? People that have diabetes have problems with their pancreas. They don't make enough insulin, or their body doesn't respond to the insulin. And your spleen also. And your spleen is responsible for production as well as storage of your red blood cells. Okay, I didn't feel anything. I feel a little fullness here. Can you feel that?
Yeah, I feel that.
I'm just going to do a little palpation just to see if we can see just so I can get a little bit more information about that. Can you hear that?
Yep.
All right. What I'd like to do is set you up with an appointment. I'd like you to go get an x-ray. I'd like to do some lab work. I'm going to send you home with a stool for occult blood. I want to make sure what's going on, see if you've got any blood in your stool. I'd like to get an x-ray of what's going on in your abdomen to start, and I'd like to set you up for a colonoscopy. Are you okay with that?
That sounds fine.
Okay.